Alrighty. Well, happy Friday, everyone. Hope you are having an amazing day. All right. So I am here to answer questions. I was here last week answering questions for about an hour. Not going to spend as much time this week for a few reasons. One is because I was on last week for an hour. So, so hopefully I've answered most of the questions, and maybe there won't be a lot of questions. But then also I'm having a 5 day event next week, which I'll for those who aren't familiar with the event that I'll be having, I'll share that with you shortly. So there'll be an opportunity to ask questions pretty much throughout the entirety of next week. So let me go ahead and, as usual, I'm just going to share resources for those who are not familiar with my podcast. It's called Save My Thyroid. You can check it out by visiting savemythyroid.com. And as it says here, has a little bit more focus on hyperthyroidism, but most of the episodes will benefit those with either hyperthyroidism or Hashimoto's. Also have another website, so naturalendocrinesolutions.com. My original website from 2010 has hundreds of articles on blog posts related to thyroid and autoimmune thyroid conditions. And then I also have a supplement line, which you could check out by visiting thyroidsave.com. And then a few books: Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. Third edition was released in October of 2023. Hashimoto's Triggers was released in 2018. And then the more recent book in March of 2024, March of this year, The Hyperthyroid Healing Diet. You can find all three of those on Amazon.com as well as other bookstores as well. Okay, so this Monday, I'm hosting a free 5 day Foundations of Overcoming Graves' Disease and Hashimoto's live events. It will include 5 daily live calls with Q&A at the end of the call. So the way it'll work is I'm going to spend about 20 to 40 minutes, depending on how much content, 20, 40, 45 minutes. And then I'll follow it up with about 30 minutes of Q&A. And then also for those who are in the Facebook group, there'll be engagements with others, of course, prizes for participation. But even if you're not in Facebook, you'll still benefit from the information. Everything will be recorded as well. So, and you could check it out by visiting thyroidfoundations.com. Again, completely free. There is a optional VIP upgrade. So once you register, you'll be good to go, but then you'll see a page for the VIP upgrade. Again, that is completely optional. And that's it. So if there are questions, like I said, I'll stick around for a little bit until maybe 2 o'clock my time. If there are questions, just because I was on last week answering questions, and then I'll be on next week. But I wanted to pop in just for those who are not familiar with the event that I'm having, just again, let people know. So all right. So we got Violet with the question. Good afternoon. I'm on mythisol. Whenever I take it, I cannot sleep. Do you think if my thyroid is too low, it can cause it? Usually not. I guess when do you take the methimazole? Is it twice per day or is it just once a day? And if you take it just once per day, when do you take it? Because I mean, usually not. Usually, if anything, the hyperthyroidism will usually cause sleep issues. I mean, everybody's different. I mean, so I mean, for example, I had a patient the other day, a new patient who mentioned how chamomile, like she doesn't do well with chamomile, and doesn't help her sleep. Where most people, that's the opposite. It usually is kind of relaxing. And same thing with magnesium. Most people, they take magnesium at night. It helps with sleep. But over the years, I've had a few people where magnesium doesn't have that effect and sometimes has the opposite effect. So methimazole usually isn't going to cause sleep issues, but I mean, it does have a lot of potential side effects, but usually sleep is not one of them. But if you're taking it later in the day, whether you're taking it twice a day and then one of the dosing later in the day, or if you're just taking once a day and later in the day, then once a day before breakfast, my thyroid is low from last year. Okay, so Yeah, it shouldn't. Yeah, I mean, I don't think so. Again, that's not a. I mean, a lot of people have sleep issues. Don't think it's due to the methimazole, but I'm not sure. Now, you said your thyroid is low from last year. So again, if you had, now you said from last year, I don't know if you've had a recent thyroid panel, but definitely would do a retest. And again, I don't know how long you've been on the methimazole for, if you've been on it since last year, if you've been on the same dose since last year, like what dose you're taking now, how long you've been on the dose, I guess is a question. Um, because if you were just put on a new dose, like any type of change, like if you've been on methimazole for since last year and it's been a similar dose, then and if the sleep issues are recent, then I would say definitely not. But if someone was recently put on methimazole and they started having sleep issues, or they had dosage changes and then had like any type of change, but if you've been taking it for a while and all of a sudden you've had sleep issues, even if you're like start even if you're becoming hypo, but then based on what you said my thyroid is low from last year, which from what I'm looking at it, it's been low for quite a while, which again, if it was low, you would think that they would reduce the dose of the methimazole. But yeah, anyway, so a number of questions I have, like that's like if you are a patient, I'd be a- asking you these questions, of course, face to face and trying to get as much information. So, all right, let's see we have another question. I am a hyperthyroid patient. My T3, T4 are normal, while my TSH is low, and I have nodules. How to treat my nodules because my doctor is recommending surgery and I don't have cancer. So I have on my podcast and my website, savemythyroid.com, naturalendocrinesolutions.com. I have both articles and podcast episodes where I talk about nodules. So when addressing the nodules, there's a few different things you could do. One, I mean, ideally, you want to try to address the cause of the problem, the cause of the thyroid nodules, and some of the more common causes of thyroid nodules, problems with estrogen metabolism. And really, the only way to look at that is through a urine test, like the Dutch test, which is a dried urine test. Insulin resistance could be a factor, which you could look at in the blood. Look at hemoglobin A1C. You could look at fasting insulin. Sometimes just inflammation could be a factor. Iodine deficiency can be a factor. So doing like a urinary test for iodine, for example, and then there's also, in some cases, if it's a really large nodule, I would still recommend trying to address the cause of the problem. But there's radio frequency ablation. Again, not radioactive iodine. I definitely don't recommend that. But radio frequency, RFA, radio frequency ablation, is a way to handle some thyroid nodules that especially are larger, and and saving the thyroid, preserving the thyroid. And I do have some information on the podcast. I interviewed Dr. Angela Mazza, who spoke about that. In a more recent interview, Dr. Brittany Henderson, but she spoke more about alcohol ablation, more for cysts than for nodules. But definitely would check out that information on the podcast. Okay, Lauren, my endocrinologist refused to do an ultrasound on my thyroid because she said I'm hyper, not hypo. Yeah, I don't know why that would make a difference. I've worked with a lot of people with hyperthyroidism who have received ultrasounds. When I dealt with Graves, the endocrinologist didn't want to do an ultrasound. The reason why is she palpated my neck, she palpated my thyroid, and then she didn't feel any nodules. But I asked her, can we do an ultrasound? Now, I was paying out of pocket, so if you're going through insurance, then I don't know, like you probably can't force her to like run it through insurance. But in my case, I paid out of pocket, so was able to talk her into me doing one because I paid for it. But if you're trying to run it through insurance, then you might have to try to go to a different endocrinologist. I mean, again, I just interviewed, I think it was Dr. Brittany Henderson, who's in South Carolina. She's an integrative endocrinologist, and and she does an ultrasound on everybody. So, which I think is great. So every practitioner is different. So your endocrinologist, for whatever reason, I mean, that being hyper is not a reason not to do. Yeah, that's not a good valid reason to not do an ultrasound. Um, and then as a follow up, you said I have Graves. She said she will do a physical exam in 6 weeks. Yeah, I mean that's great, but I mean, like I said, I wanted an ultrasound because a physical exam, even though she might be really experienced, but still, yeah, I would. If you want an ultrasound, and if she's not willing to do it, maybe you could switch to someone else. If for any reason you can't switch, then I'm not sure. Yeah, I mean, you don't necessarily have to see an endocrinologist to get an ultrasound. You might, I mean, you need an order, but you could go back to your primary care doctor. Maybe if you have a local chiropractor you're seeing, they might be able to write an order for you to get a local to get an ultrasound. Okay. And you have a follow-up question. Can hyperthyroid patients take iodine supplements? Um, It depends. I mean, again, the answer is yeah. Yeah, I'm not gonna say yes. You should take it because again, iodine. There's a lot of information out there on iodine. I have information in my books, on my podcast, on my websites. Again, it sounds like a simple question, but some people with hyperthyroidism do okay with iodine supplements, but many people don't. And some people it can be problematic. So I definitely wouldn't do it without any testing, and I wouldn't do it without working with someone. It's my approach to iodine is definitely different now than it was in the past. And if you check out my more recent book, Natural Treatment, or not more recent book, but my updated version of Natural Treatment Solutions for Hyperthyroidism and Graves, the third edition, I talk more about that. But there's also some information on the podcast as well. Can I still use Dutch test results from December, January this year, especially if I've not taken any supplements since and feel the same? I mean, things could definitely change, but I know I mean, it's not a cheap test to do and to keep on doing Dutch tests. So if you didn't do anything to take action based on the findings, I mean, if that was me and if I did a Dutch test in January and didn't follow the recommendations given, I probably would just do what you're saying. I probably would just follow the protocol and not do another retest. I mean, if money was unlimited, of course we would say, "Oh yeah, we just do another one." Hey, why not do one every quarter if it's free, but like every 3 months, but in all seriousness, um, yeah, I mean, it's within the year, so it probably would be okay if this was like over a year, then maybe at that point you'd want to consider doing a retest. Again, ultimately, it's up to you. But in a perfect world, yeah, like we want to retest because things could definitely change within the 8 months that you got it tested. But like you said, you didn't do anything to you didn't do anything based on the findings. Doesn't mean things still couldn't have changed, but as I mentioned, if I were you, I probably would just follow the recommendations, but or assuming you were given recommendations. Okay, recommendations for subclinical hyperthyroidism. I am a symptomatic 21-year-old female. Yeah, I mean, someone asked this in the Facebook group because I just released an episode on the podcast, like consequences of unmanaged hyperthyroidism. A little bit trickier with subclinical hyperthyroidism because with subclinical hyperthyroidism, typically you have a depressed TSH, but thyroid hormone levels are within range. So you usually don't want to take anti-thyroid medication because again, the thyroid hormones are looking good. Now, bugleweed in some cases is an option because it's not as potent as anti-thyroid medication like methimazole, so it could help to calm down the symptoms while trying to address the cause of the problem. Motherwort is one that doesn't affect the thyroid, just helps with the cardiovascular symptoms. So those, again, I would recommend working with a practitioner, especially with the bugleweed. I mean, I'm always going to say work with a practitioner. The motherwort is really just helping with the symptoms. So I'm not as uncomfortable with someone just experimenting with motherwort, but with bugleweed, since it does affect the thyroid, I would usually recommend to work with someone for that. And then trying to address the cause of the subclinical hyperthyroidism, which again, that's just what the approach I take is just try like it's different than autoimmunity, a condition like Graves, but I still look to address some of the major like testing the adrenals, working on healing the gut, correcting nutrient deficiencies, reducing one's toxic load. So just doing everything you can to achieve optimal health. And I'll add, I don't know if this is the case with you, but some people have subclinical Graves' disease where the TSH is depressed, thyroid hormone levels are looking okay, but they do have the autoantibodies for Graves, the thyroid stimulating immunoglobulins. And so, again, you want to address, find, remove the triggers, heal the gut, correct underlying imbalances. Can you take bugleweed with methimazole? Sometimes I do recommend bugleweed with methimazole. Like if someone's taking methimazole, and if I mean, in a perfect world, nobody wants to take methimazole, but some people tolerate it okay and they're comfortable with taking it while addressing the cause of the problems. And then there are others who they'll work with me and they're like, oh, I don't want to be on methimazole. And like they're really upfront about it, very vocal about it. And so if that's the case, I mean, they could take bugleweed, maybe not at the exact same time as the methimazole. So maybe they take the methimazole and then they take bugleweed 30 to 45 minutes later. And then the goal is to monitor the thyroid levels and hope that over time, that by being on both of those, especially, that the person will become more hypo, and then the prescribing doctor will reduce the dose of the methimazole, so the person's relying more on the bugleweed. And if that pattern continues, eventually get to the point where they don't need the methimazole and they're just relying on the bugleweed. And then over time, getting to the point where they don't need the bugleweed either. So the answer is yes. That and I do have some people with methimazole also add the bugleweed. All right. Any other questions? And again, just a reminder, as you see on the screen, I'm hosting a 5-day Foundations of Overcoming Graves' Disease and Hashimoto's event. And again, that starts on Monday. The calls will vary because in order to accommodate those in different time zones. So Monday, Wednesday, Friday, I'll have live calls at noon Eastern time. Tuesday and Thursday at 8:30 p.m. Eastern time. Everything will be recorded if you can't attend live. And there's an optional VIP upgrade. And yeah, thyroidfoundations.com. Causes of elevated thyroglobulin antibodies. I mean, it's the same potential causes of any elevated antibodies. So, with elevated antibodies, there's four main categories of triggers I talk about: food, stress, chemicals, infections, and then having a there's what's called the triad of autoimmunity. So I should back up. Triad of autoimmunity, three components necessary for autoimmunity to develop. One is a genetic predisposition, and you can't do anything to change the genetics, but thankfully, you can do things for the other two components, which can help to reverse the autoimmune component. So, second, what exposure to one or more environmental triggers, and that's what I just mentioned: food, stress, chemicals, infection. So, doing certain testing to find the triggers, or even just cleaning up your diet and lifestyle. Again, that many times doing that alone isn't enough, but a good place to start. And then, third factor is an increase in intestinal permeability, which is a medical term for a leaky gut. So, healing the gut. So, again, that's as far as causes of the elevated thyroglobulin antibody, again, there's some genetics involved, but finding, removing triggers and healing the gut, uh, or should I say the triggers, typically there's different triggers, and then also having a leaky gut. So the triggers combined with the leaky gut is what causes not just the elevated thyroglobulin antibodies, but other antibodies as well. Okay, just a reminder, I'm going to go about another 10 minutes. I did go an hour last week, and I'll be going every day. I'll be live every day, Monday through Friday, which is why I'm popping in again today. Just a reminder that if you're not registered for the free events, to definitely take advantage of that. And but again, I'm not going to go a full hour today just because I'm not fully prepared for Monday. And tomorrow I have an all-day seminar in South Carolina, so tomorrow I won't be getting anything done. So it's pretty much the rest of today and Monday and Sunday uh, to put the finishing touches and finishing up like the slides and stuff. So, Lauren, what test should we ask for outside of T3, T4, and TSH? Um, I mean, there's a lot of tests that definitely check out my. I mean, again, I have a lot of information on the podcast. Uh, just because, again, I could roll off some, like I could just talk about some tests, but I'm going to miss some. Um, I mean, we'll look at the antibodies. If someone's dealing with hypothyroidism, Hashimoto's, reverse T3. I usually don't test reverse T3 with hyperthyroidism. But then always do a CBC with differential, comprehensive metabolic panel, lipid panel, 25 hydroxy vitamin D, iron panel, vitamin B12. Look at CRP, which is C-reactive protein, homocysteine. So those are some of the tests that I recommend. And then I do functional medicine testing like adrenal testing, hair mineral analysis, sometimes comprehensive stool test. Again, if the books are the best place because everything's organized. Like you could also go on the podcast and that's completely free. But if you have hyperthyroidism, then natural treatment solutions for hyperthyroidism and Graves' disease. I talk about the testing in the book, and then Hashimoto's triggers for those with Hashimoto's. I also really go into detail with different types of tests. So if you want everything kind of organized, I would just invest in the book, which obviously it's a book, so it doesn't cost too much. But you could also find this information on either the podcast, and there's a search box with the podcast, savemythyroid.com, as well as my articles, naturalendocrinesolutions.com. Can you eat eggs and chicken and grains with Graves? I mean, chicken, yeah. I mean, chicken is paleo friendly. It's AIP friendly. I usually grains is not AIP friendly or paleo friendly. So I usually recommend taking a break from grains while healing, and then eggs. If you're following an AIP diet, you would want to take a break from eggs. If you're following a paleo diet, then eggs are okay. Um, So let's see here. Jane Elizabeth, diagnosed February 24th with Graves, hyper TSH 0.12, free T3 4.3, free T4 1.8, started on 10 milligrams of methimazole. Endocrinologist will only diagnose via TSH. TSH keeps on going up. 724 reduced to 5 milligrams of methimazole, but TSH 6.07. Oh, wow, so pretty high. Free T4 1.1, free T3 2.8. He would like me to reduce methimazole to 2.5. I would prefer to come off methimazole as he refuses to test antibodies again until I've been on methimazole for 12 months. At this point, with free T3 and free T4 in range, is there a natural protocol I could use? I mean, if you just talk about like a replacement for methimazole, um, I mean, there's like bugleweed. Someone asked before about can you be on bugleweed and methimazole at the same time, and you're on a low dose of methimazole. So, I mean, we're going to reduce it or 2.5. I mean, 5 milligrams or 2.5 milligrams. Those are both low doses, and yeah. So, again, you could like people. Sometimes I'll put a person on bugleweed with the methimazole, again, I can't tell you to get off the methimazole, but when I dealt with Graves, I took bugleweed. I did not take the methimazole, and so yeah. So like I said, that is an option. I took bugleweed. I took motherwort. Again, I have episodes on the podcast. Talk about that in my book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, third edition. If you don't have that, um, but as yeah. So I don't know if that's what you mean as far as like protocol, but that's like a natural symptom management protocol. I do have. If you visit saymythyroid.com/3 episode 3, I talk about the natural symptom management options like bugleweed, motherwort, higher doses of L-carnitine. So you might want to start with that. That's completely free. If you want more information, the book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. I mean, there's other things I recommend, not just taking bugleweed, motherwort, lemon balm, but that is really based on testing for the triggers, trying to find the underlying imbalances. I don't just have like a general Graves' disease protocol that I just give to every single person with Graves. So it really does depend on the person. All right. All right. Lauren, missed my comment. I mean, keep in mind this is recorded, but I mean, essentially, chicken, yes. Grains, no. Eggs, if someone's following a paleo diet, yes. If they're following an AIP diet, no. And again, you might want to check out if I don't know uh, if you have hyperthyroidism, then I have the Hyperthyroid Healing Diet book, which just recently came out, and then Hashimoto's Triggers for those with Hashimoto's, where I talk about diet in that book. Okay, Lauren, you are welcome. Okay, I've just been diagnosed with toxic multinodular goiter. Any advice? Yeah, I don't remember the episode number, but on my podcast, it might be episode 9. It's within the first 10, but trying to address the cause of the problem, ideally with the nodules, multiple nodules and the goiter, problems with insulin resistance, problems with estrogen metabolism, sometimes inflammation. Uh, but yeah, check out that interview, or I'm sorry, check out the podcast episode. Actually, I am having like an interview like with a person who has toxic multinodular goiter, but I'm not sure when that's coming out. So I'm going to start doing some interviews just with people with hyperthyroidism, Graves, toxic multinodular goiter, Hashimoto's. So you'll be eventually seeing those on the podcast starting in September, I believe. But yeah, so like I said, listen, check out that episode, and all right, again, I'm gonna sign off soon. Again, next week, if you haven't registered, again, I'll be answering questions all week. Um, yeah, thank you. Yes, that was my question. At bugleweed, so low dose methimazole. I do have your book. Love it. Just looking for some reassurance. Yeah, so I do that with a number of patients. Um, And then I think I do need to look at the underlying imbalances, hormones, adrenals. I am having some dental work corrected as well. Awesome. That is wonderful. Um, and you are welcome. Lauren, celery juice in the morning. I have a podcast episode. Go to savemythyroid.com and type in celery juice, and you'll see I have a podcast episode where I talk about celery juice. Buying the book. Thank you, Dr. Eric. Primarily growing up with the South Indian diet, rice is a staple. So is wheat. Are these no-nos when trying to protocol? Are there recommended replacements? I mean, wheat is definitely a no-no. I mean, rice, if you're following paleo or AIP, yes. If the hyperthyroid healing diet, which again, a lot of it applies to Hashimoto's, like there's a level 1 diet, which does allow some flexibility with grains. It's not for like if someone's a vegan vegetarian. So ideally, you'd want to take a break from those. But if someone's vegan vegetarian, but I understand rice is a staple in some areas, like India and Asia. Um, I mean, you could also try cauliflower rice, not the same, but cauliflower rice is AIP friendly. But I mean, If you're doing everything else but eating like white basmati rice, for example, would that be the end of the world? I mean, it depends on the person. I mean, grains can be harsh on the gut. There is a book by Dr. Peter Osborne that I recommend, No Grain, No Pain. But it doesn't mean that everybody has problems with grains. If you read that book, he'll, of course, recommend to completely avoid grains. But truth is, everybody's different. So, and does the book have info for folks that swing between hyper and hypo? I don't remember, but I do have some information on that on the podcast about going between hyper and hypo. And Lauren, thanks. I'll cut out grains and get your book on what to eat with Graves. Yeah. So if you have so get hyperthyroid healing diet. Um, if you haven't already, gets awful. Yeah. No, I understand that Medicare. Yeah, I understand. So I mean, do what you could do from a diet and lifestyle standpoint. If you're on a budget, again, try to do everything: diet, stress management, getting proper sleep. Um, Yeah, so I definitely understand. And then any recommendation on what to do with abnormally low testosterone levels with slightly depressed DHEA? I believe this is Dutch test. And estradiol was also low from the Dutch test. Testosterone isn't completely reliable on the Dutch, and if you look the notes at the after the results, there are notes. It'll say that if your testosterone is really low, test it in the blood. But when you have when other hormone levels are low, I always look at adrenals. You need healthy adrenals to have healthy sex hormones. Not to say there's not a time and place for HRT, hormone replacement therapy, but I always recommend to do things to optimize the adrenals. So, is wild or brown rice good? I mean, again, I usually recommend taking a break from grains, including rice, while healing. But based on Dr. Stephen Gundry's work, he has an excellent book, The Plant Paradox. He's done a lot of research with the different foods, including grains and the problems with plant-based foods. And and yeah, so he recommends white basmati rice, but that's based on his research. Okay, there's two more questions. I'm going to answer these two questions and I'm going to call it a day. And again, Monday, if you have other questions, definitely tune in next week to at least one, if not multiple calls. Sunita, both my sons have high reverse T3, high T4, high liver enzymes. How can I help them? High T4, high liver enzymes. I mean, start with diet and lifestyle. Again, seems like a simple question, but the answer isn't simple. So 19 and 16-year-olds. And again, it's not easy. I have a 19 and a 17-year-old. I have two daughters. um, again, they don't have thyroid issues, but again, if they did, the again, diet. I realize diet's not easy in adults, let alone in children, but just trying to eat whole, healthy foods. Get the book, get my recent book, Hyperthyroid Healing Diet. Is what I would recommend. Obviously, I'm biased because it's my book, but again, it's low cost. I mean, you could also look, there's a lot of free information on my podcast, Say My Thyroid. But again, I think it's worth whatever it costs, the $20 to get the book, or you could get the Kindle book for like less than $10 and follow the recommendations that are in there. It goes into detail with the diet, the lifestyle, even has a section that goes beyond diet and lifestyle. Okay, so this is going to be the last question, and it's again from Lauren. How long would it take for? And I think I got to everybody. So, how long would it take to detox from OTA mold? Level was 372. That was the trigger that caused Graves for me. I mean, that's a pretty high level. So that's like really, really high. um, I mean, you got to get rid of the source is the number one thing. So if you don't get rid of the source, obviously you're going to continue to have to detox. So, but if you get rid of the source, I mean, it could take still quite a while. I mean, it could take like 3 to 6 months. Um, but I mean, I would say 3 months, and maybe at that point, see how you're feeling, see how your thyroid numbers are looking. And then at that point, maybe do another mycotoxins, urinary mycotoxins test to see what the levels look like. But I would at least give it my opinion would be at least 3 months before looking to retest. So, but yeah, hopefully you're working with a functional medicine practitioner for that. And and yeah, so all right. Well, sorry to keep it shorter today. Again, I was on last week for an hour, and I'm doing it this week. I usually don't do back-to-back weeks, but just because I'm having the event on Monday, I wanted to pop in again, just answer some questions, but also remind people that I'm going to have the free events next week. And even if you don't have Graves or Hashimoto's, if it's non-autoimmune, a lot of the information will still be beneficial. But especially if you have Graves, Hashimoto's, definitely attend. Again, I'll rotate the times to accommodate those in different time zones, and the record that will every live session will be recorded, and that is it. So again, hope everybody has a great rest of your day. And thank you for your questions and for tuning in on this Friday. Hope to see some of you, if not most of you, next week during the live events. And again, have a great rest of your Friday and a great weekend ahead. All right. Take care, everyone.